Hello everyone, my name is Brittany Heckler. I'm an LPN to BSN student at Indiana State University. I am currently taking Nurse 444 Community Health Nursing for the spring 2022 semester. This is my last final community health nursing project, and it's going to be on end of life and hospice care. You matter because of who you are. You matter to the last moment of your life, and we will do all we can, not only to help you die peacefully, but also to live until you die. Dame Cicely Sanders was the founder of the first modern hospice. Populations at risk. Hospice care affects all people in all communities, especially people with advanced life-limiting illnesses. Learning objectives for this presentation are: the viewer will be able to define what hospice is, the viewer will be able to summarize when hospice care should start, the viewer will be able to distinguish the different members of the hospice care team, the viewer will be able to recall what services hospice provides. The viewer will be able to recognize resources available to hospice members. The viewer will be able to explain the importance of hospice. At this time, if you don't mind, please take a moment to pause this presentation and take the pre-quiz. The link is located below in the video description, or copy and paste the link on this slide in your internet browser. What is hospice? Hospice care is a special kind of care that focuses on the quality of life for people and their caregivers who are experiencing an advanced life-limiting illness. Hospice care provides compassionate care for people in the last phases of an incurable disease so that they may live as fully and comfortably as possible. The hospice philosophy accepts death as the final stage of life. It affirms life but does not try to hasten or postpone death. Hospice care treats the person and symptoms of the disease rather than treating the disease itself. A team of professionals works together to manage symptoms so that a person's last days may be spent with dignity and quality, surrounded by their loved ones. Hospice care is also family-centered. It includes the patient and the family in making decisions. Statistics. What are the characteristics of Medicare beneficiaries who received hospice care in 2017? These are the stats from the National Hospice and Palliative Care Organization. Between men and women, there were 58.4% of females that were on hospice, and there were 41.6% that were male on hospice in 2017. The average length of hospice care is just over 71 days. Patient age. In 2017, about 64.2% of Medicare hospice patients were 80 years of age or older. Over 80% of the hospice patients are 65 years of age or older. The number of hospice programs nationwide continues to increase. Today, there are over 6,000 programs compared to just over 5,000 in 2010. When should hospice care start? A person does not have to be bedridden or in their final days of life to receive hospice care. It is most beneficial when the patient and family can receive care early to take advantage of the many benefits hospice care can offer. It can be used for months if eligibility is met. Some eligibility criteria are: there is a significant decline in physical and/or cognitive status despite medical treatment. This may include increased pain or other symptoms, substantial weight loss, extreme fatigue, shortness of breath, or weakness. The goal is to live more comfortably and forego the often physically debilitating treatments that have been unsuccessful in curing or halting a life-threatening illness. Life expectancy is 6 months or less, according to physicians. The person is in the end stage of Alzheimer's or dementia. Who's involved in hospice care? If you're not receiving hospice care at a dedicated facility, hospice staff will make regular visits to your home or another setting. Hospice staff is on call 24 hours a day, 7 days a week. Hospice care team typically includes doctors, nurses, home health aides, spiritual workers, social workers, volunteers, other professionals, bereavement counselors, and pharmacists. What services does hospice provide? Most hospices follow Medicare requirements to provide the following services as necessary to manage the primary illness for which someone received hospice care. Time and services of the care team, including visits to the patient's location by the hospice physician, nurse, medical social worker, home health aide, and chaplain/spiritual advisor. Medication for symptoms control, including pain relief. Medical equipment like a hospital bed, wheelchairs or walkers, and medical supplies such as oxygen, bandages, and catheters. Physical and occupational therapy, speech-language pathology service, and dietary counseling are only services that are determined by a case-by-case basis, and depending on an assessment of the hospice team, the goals of care as established by the hospice team, and disease progression and symptoms burden. Any other Medicare-covered services needed to manage pain and other symptoms related to the terminal illness as recommended by the hospice team. Short-term inpatient care and respite care for family caregivers. Grief and loss counseling for the patient and loved ones who may experience anticipatory grief. Grief counseling is provided to family members for up to 13 months after a death. How do I select a hospice program? To find out about hospice programs, talk to doctors, nurses, social workers, or counselors, or contact your local or state office on aging. Consider asking friends or neighbors for advice. Some criteria that you might want to look for when looking into a hospice program are: is the hospice program Medicare certified? Is the program reviewed and licensed by the state or certified in some other way? Is the hospice program accredited by the Joint Commission? Who makes up the hospice team, and how are they trained or screened? Is the hospice medical director board certified in hospice and palliative care medicine? Is the hospice program not-for-profit or for-profit? Does the hospice program have a dedicated pharmacist to help adjust medications? Is residential hospice available? What services are offered to a person who is terminally ill? How are pain and other symptoms managed? How are hospice care services provided after hours? How long does it take to get accepted into the hospice care program? What services are offered to the family? What respite services are available for the caregiver or caregivers? What bereavement services are available? Are volunteer services available? Are hospice costs covered by insurance or other sources such as Medicare? Hospice care is about more than helping people die with dignity. It's about helping them live out life with love. Thank you for viewing this presentation. After this slide, please take a moment to take the post quiz. The link is located below in the video description, or copy and paste the link on this slide on your internet browser. Thank you again. Some great resources out there that you can use to find out information about hospice are the National Hospice and Palliative Care Organization, Hospice Foundation of America, Centers for Medicare and Medicaid Services, and the National Institute on Aging. References. The references used for this presentation are from the American Cancer Society, the Hospice Foundation of America, and the Mayo Clinic staff.